And we are live. Hey Fab Squad, it's Dr. Jamie, your lifestyle pharmacist, and I am so excited that it is time for another episode of Live with the Fab Squad. So excited. So, y'all, we have been doing this live educational series that has been completely free, no cost to you, because I really wanted this time of transition in all of our lives to be one that was meaningful and impactful. And I wanted to remove all barriers for you all getting information that will help you navigate this challenging time. So that's the why behind this series. And I didn't want to just come myself solo every time. So I called in the reinforcements, some backup, my amazing super friends who have been rocking it when they have joined us. And tonight we have another one of my amazing super friends, Dr. Zarinah. She's gonna be sharing with you all a very special topic, one that I get a lot of questions about. And so I said, you know what, let me bring in an expert to talk about this. And we are gonna be chatting about pain freedom begins with me. And it begins with you as well, right? So for those of you who may not know who I am, I'm Dr. Jamie Hardy, the lifestyle pharmacist, and I'm a board certified pharmacist, a speaker, I'm a best-selling author, an event producer, but most importantly, I care about your lifestyle. So I teach women how to be fit, fabulous, and fulfilled without those prescribed pills by making changes in your lifestyle, right? We're not talking about all drugs over here, no. So that's who I am. And like I mentioned, we have a very special guest. And so Dr. Zarinah, let the Fab Squad know who you are. For those who missed the Fab Gathering Summit in Memphis, they didn't see you live, right? But this is a chance for those who have met you before to experience you once again, and for some other members of the Fab Squad to maybe meet you for the first time.
Well, thank you, Dr. Jamie, for having me. First of all, you know I love you, and I love the Fab Squad. We got really acquainted last year, so it was a lot of fun. And yeah. Yes, for those who were not there, I am Dr. Zarinah, also known as Dr. Z. I'm a sports medicine integrative pain management specialist. I help individuals, groups, and corporations go from pain to pain freedom long term. And I do that from the inside out and the outside in so that you can truly become the MVP, the most valuable person for your life and health. So I'm so excited to be here. I'm so excited to share with you all more about what true pain freedom really is, which starts with the mindset, but it goes deeper. So I'm so excited to be here. Thank you, Dr. Jamie.
You are so welcome. Thank you for saying yes and carving out time to be here with us, because you had a busy day at your place of employment, right? Because you still take care of patients.
I am still taking care of patients, virtually as well as in person. So yes, it's been a full day already, but you know, I'm gonna show up for you, boo.
Oh, thanks. All right, so look, we're gonna get right into this, because there are people in my family, people in my tribe who are living with chronic pain. And there are also people who are living with this pain and they're not as expressive. They don't have someone that they feel that they can trust this information to. So many people are dealing with this, unfortunately, you know, by themselves if they don't have an outlet or a person to talk to outside of their, you know, primary care practitioner. Like every day, you know, having somebody to kind of lean on and lean in and kind of talk to. So that's why we are talking about this topic today. So let's get into one that's kind of in my realm as a pharmacist. There is an opioid epidemic or crisis, in the United States especially. And I'm sure a lot of people have seen the headlines about people, dying from drug overdoses. And so in my experience, that has led some patients to be resistant to taking prescribed painkillers or opioids or narcotics for their pain, even when they've been prescribed to them by their doctor. So, for those who are not wanting to go down that prescription pain medication route, are there any things that they can do, Dr. Z, from a, non-pharmacologic or non-drug related, perspective to make their pain more manageable?
Yes, it is. And this is one of my most favorite topics to actually discuss, because like you said, I do try my best. That's one of my first things. I think that should be the last resort, actually, in terms of opiate prescription management. And oftentimes, still in America, that's not always the case. Some of that has to do with that we have, non-specialists who aren't necessarily trained in pain, right? That are prescribing because they can. They, have license to do so. But that kind of, does, I think, play a role into the management and sometimes mismanagement of when we prescribe them and when we shouldn't. So who would benefit from an opiate? Typically, I say if it's an acute pain, like a major trauma, something like right after surgery. I have a big population of patients who are afraid to take even after surgery, and I have to remind them surgery itself is a trauma, right? Yes. It's a surgical trauma, but it's a trauma, and I don't want them to psych themselves out and then suffer in that first 3 weeks after surgery because they're afraid to take the opiate. So from that perspective, I say that is a pretty good and standard practice to give someone something a little bit stronger because they just went under a major surgery. So that's typically is an appropriate time to use opiates or narcotics in that particular setting. Also, if you had an actual trauma, be a motor vehicle accident acutely or subacute even, and I'm gonna break down what acute versus subacute means. Maybe you had a sports injury. I'm a sports medicine doctor, see that a lot, right? Sometimes that's the case. But when you start getting into the chronic, the whole idea is that we want to actually manage that and get underneath whatever the trauma or the root cause was it very, very early so that we can avoid potentially the need, either the need for it altogether, or definitely reduce the length of time that you would need it so that you can get on to being healthy and whole and healing without going into this phase of chronic pain. Acute pain is typically something that's going to be in that 0 to 3, 0 to 6 weeks. Once you get in this 3-month range, that's most of the time considered to be maybe subacute. But once you pass that, especially 6 months and beyond, that's when we're getting into what we call chronic pain. And that is what my passion is, to avoid, reduce around the world, quite frankly, our patients and our Americans and so on and so forth from going into that phase. So that is a pretty generalized answer, but in general, yes, we can avoid it if we can, but also there is an appropriate time to use that. But from a non-pharmacological perspective, there also are things that you can do that are natural, right? And that's the kind of caveat too, because I think a lot of our patients are like, well, I don't know what to trust and what not to trust, right?
Yes.
I hear so many things, I Google so many things, I see so many things out there, and that's where your physician comes into play. That's where your specialist comes into play. Now, some have power too. Well, my pain doctor doesn't know about that stuff. Well, there are physicians out there that do. As myself included, I'm an integrative pain management specialist, which means my background is not just in the traditional sense, but integrative approaches as well. Hence, because one size doesn't fit all. You and I both know that so well, right? That depending on your lifestyle, depending on your values, depending on your religion, whatever, right? That you got to meet people where they are. So sometimes it's going to be integrating where you are so that we can introduce things like turmeric. We might introduce things like even ginger, believe it or not. There's other things. Some people, you still have the things like glucosamine and things like that. But we can go into a little bit more detail because I know we're going to touch on that a little bit later. But the point is, we definitely can do things early on, even acutely, actually, to minimize that. Ice is still, I call it Motrin. Nature's Motrin. or nature's painkiller, so to speak. We still sometimes, even in a hospital settings, we minimize the impact of that. And even after surgeries, yes, big time. Even after surgery, sometimes I'm still finding patients who were never offered ice, for that swelling or for that inflammation. And once they get it, they're like, wow, that actually was probably more impactful therapeutically than the pain medicine they gave me. Right?
Yeah.
So we have to remember sometimes it's about the basics, and we don't always have to bring out the big bazooka.
The big guns,
initially.
right?
Yeah, definitely.
I love that. So getting back to basics and not forgetting about those, simple things like ice. So y'all heard it from Dr. Zarinah. You don't have to be afraid if you especially have had surgery. For any of my Fab Squatters out there who are recovering your post-op from a procedure, a surgical procedure especially, you were given that prescription. So now would be the time, if your pain is of such that, you're feeling like you need it, not to be afraid to take it, especially in that immediate, post-operative period. All right, so living through the pain, right? Because, not all pain is acute and just resolves and goes away. Chronic pain is a real syndrome. It's a real serious situation that many people are still having to navigate life and bring that along with them. So what are some things that people can do in their lifestyle? And y'all know I'm here for all the lifestyle nuggets. So for those of my Fab Squatters who may not have been following some of these, things that we have previously talked about, Dr. Zarinah is going to put that pain freedom spin on it so you can hear some more lifestyle tips. So she's going to be backing me up on all this lifestyle stuff. But anyway, what are some lifestyle tips, for living through the pain?
One of the biggest things you can do for yourself is really truly first make a decision, which means it's the mindset, right? It goes back to the mindset. So that's a huge thing. My 3 components that I put into my formula, if you will, are actually not necessarily things that come in a bottle. It's your mindset, it's your physical, right? Some things that you have to do physically, and it's also your nutrition. We cannot minimize that what we eat or what we're not getting enough of. Okay, I'm gonna say that again too. Sometimes it's what you're eating or what you're not eating. You're not getting enough of that is going to potentiate or activate or exacerbate your pain. And so we have to be very conscious of that. What are some examples of that? Well, some things that you could be doing in your lifestyle that could be exacerbating your pain could be alcohol. That will exacerbate your pain. We know that scientifically. Smoking, right? Sometimes we talk about it, sitting the new smoking. Well, in so many different ways, I can't even break that down. We don't have enough time for that, right? But it causes vasoconstriction. So if the whole point of healing and for something there's an injury, even if it's a non-traumatic injury, because we do have pain that is not all from a trauma. It could be repetitive use type of injury pain that came from maybe the kind of job you did or whatever your history physically was in the past. So it's really critical that we understand that too. But smoking can cause that vasoconstriction. So I'm always pleading with my patients to let me help you, right? From that perspective, because I can do everything in the book. I can throw everything I have at you. But if you're still smoking or you're still drinking quite a bit of alcohol, those things will exacerbate your pain. So it's almost like undoing all these great things that we're talking about. What are some things that you could be doing and making sure that you're ingesting from a food perspective or nutritional perspective that can help reduce your pain? Well, we're talking about anything that is out there that we know to be anti-inflammatory. Inflammation is not always the bad guy. Let me actually make that clear too, because sometimes inflammation is necessary, part of the healing process. It's when it is excessive, right? That's when that becomes an issue. And some pain is actually not due to inflammation. You ever heard of the conversation about, you probably maybe have heard, the steroid injection didn't work, or that the steroid dose, Metro dose pack didn't work, the little stick, right? Sometimes that didn't work. Why? Because the pain is actually not due to inflammation. It may be due to what we call ligamentous laxity. Again, that something could be done, that could be from overuse or from many years of something else. Eventually in the acute and subacute phase, inflammation is probably the biggest culprit. But once you get out of that subacute phase of pain and you get into the chronic pain, You will have waxing and waning of times where it is inflammation, but it's not always necessarily the primary reason that you still have the pain. It could be malalignment. It could be laxity in the ligaments and the connective tissue, right? So we have to be having those conversations that is not always talked about. And then how do we address that? Well, one of those things is prevention, as you just talked about, with our lifestyle, right? In terms of strengthening and flexibility and the combination of the two, that's extremely important. You know, my athletes are the worst at it. Not all of you, so you know, love y'all, but many of you are, because you work out, you're trying to get strong, strong, strong. My gymnasts do better about that because they want both, but my track runners at times, or my basketball players, my football players, my hockey players, flexibility, or thinking about the importance of their flexibility, is always not the forefront of their mind. So you may be 50 something years old and you say, I'm working all the time, Dr. Z. I'm, moving all the time. I get that one too. But moving is important. So I don't want to minimize that you're mobile. But I always say that mobility and exercise is actually not the same thing. We want to do things that are going to build our strength and get our heart rate up, right? We want to do that because we need that cardiovascular health. What does that do? Believe it or not, it decreases inflammation, hence helping many people decrease pain, right?
Yeah.
So Dr. Jamie has been telling y'all, listen to her. Dr. Jamie knows what she's talking about. Okay, we all, like she said, I'm over here to co-sign and to reiterate the fact that the lifestyle is critical, making sure that you're highly hydrated. If you're dehydrated, that can cause what? More pain. Okay, these are all scientific. I'm not making this stuff up. If you don't believe me, go to the biggest research website that you can find, and I promise you're going to see article after article after article backing this information up, which is why we stress it so much. It's not so much of what's in the bottle. And then the mindset piece of it is huge, because what I actually found, Dr. Jamie, is after many, many years of dealing with chronic pain, is that more often than not, the patients who have chronic pain don't have the chronic pain by itself. They typically have pain of other places too, be it emotional pain, emotional traumas, psychosocial issues from their past, or even from their present. And that part is very difficult to tease out if when they come in the office, we just look at their back or we just look at their neck, right? We have to dig a little deeper as physicians to take that time to get into the psychosocial history of these patients. And it may sometimes take you all the way back to when they were 10 years old. Sometimes it does. Now, I know we don't have that kind of time right in our exam rooms, but what we can do is then be able to direct them to the right place so that they can be addressed with their psychosocial issues that can also be causing psychosomatic, right? So the psychological pains and traumas can manifest themselves. Hence, Dr. Jamie talks a lot about stress, right? Stress can manifest itself into pain. So if I'm addressing you from a medication perspective, even some of our more natural injections that we may do that are more natural, that helps basically just using your own body's capabilities to heal, none of that is as going to be as effective or maximize your healing process if I'm not helping you address the other pain, right? That is psychosomatic, that is psychosocial, that is playing a role into that. As I talk a lot about pain journal, gratitude journal, combining them two, they're really, really critical, because when we can speak gratitude, when we find ways to be thankful, when we also are paying attention to, like we talked about a little bit offline about our pain journal or pain log, helping you articulate it, put words on it, paying attention to the triggers. All of these things are part of this lifestyle that Dr. Jamie is talking about. So as you can see, we just mentioned so many things. We talked about hydration, we talked about nutrition, we're talking about mindset, and we're talking about exercise. All of those things are things that we actually have to actively do, and I can't give it to you in a bottle. But there are people out here to support you so that you can get there and you don't have to do it alone.
And Dr. Z, I love that you talked about the psychological, pain and trauma that exists. And it is very challenging for, people to separate the pain that's manifesting physically in their body from the pain that has a different origin. Because it's been my experience that, people say, I hurt all the time. I'm just in pain all the time. But it's hard for their provider to really, do something with a statement like that. So I love that you mentioned keeping that, pain and activity log, because, you know, the days that you had a good day, you felt that your pain was at a, you know, a lower level. Thinking about the activities, what were you doing that day? And
Right.
on the flip side, when you've had a day that was more, you know, painful in terms of the intensity or the scale of your pain, what physical activity were you doing? What triggered that? What was different? So that attention to the detail really matters, because their doctor wants to get them on a path so that they can live a life, you know, that's as enjoyable as possible. And those details will help their healthcare team to really delineate all of those, you know, little details. I love it.
Absolutely. It's about putting yourself back into the driver's seat, right? Pain
Yeah.
freedom is like you're taking control of that so that you can have true freedom, right? Freedom doesn't necessarily mean there's just zero pain, but it does mean that you can take the wheel, that you can take the wheel and put yourself in the driver's seat and identify exactly what you said. Where is this actually coming from? So often we're just floating and moving and just, you say, I'm in pain, but we're not being deliberate about approaching that pain. We're not being as deliberate about identifying, breaking it down, putting a word on it, and really giving it the breath that it needs, so that then we can start to truly heal and move through it. I don't say past it, because that's not the point. Then it's going to come back to you. I say move through it.
Yeah.
So that's a critical piece. And part of that is, like you just said, the intentionality behind it, which is why logs and journals are so important. And I haven't met a person who it didn't benefit unless they didn't do it.
Mm-hmm. And I have not met a healthcare practitioner, because I talked, you know, y'all are my friends in real life. So I have not had a session meet on live or off camera conversation with any of my super friends that said, I had a patient that came into my practice today and they had the nerve to bring a log with their blood pressure and their pain and their blood sugar and their this and their that. And I was not having it. Nobody says that. You all want all of that information.
Nobody nowhere ever have said that. Exactly. You're never gonna get that complaint. Correct. Not in your circle of doctor.
Right, because, you know, our role as the patient, and I'm including myself, is to be empowered and, you know, partner with our healthcare team and give them, you know, that behind the scenes viewpoint of what's happening day to day. You know, you all are seeing us in that moment. It's like a snapshot of what's happening. You know, you get the labs and that provides additional data, but as much information and data as we can be armed with, the easier and more beneficial, you know, you all can be in putting a plan together that will work for us.
Absolutely. And I wholeheartedly believe that the success rates that I have, and I say have, but I really mean we, like myself and the patients, the success rates that we have is due to the very fact of what you just said. We have to dig deeper in treating the whole person, right? The mental things that's going on, what's happening at home, what's going on physically, because sometimes maybe it really truly was triggered by a physical entity, but you already had that past psychosocial trauma that was never dealt with. So it makes it easy for that physical pain to just exacerbate and go wild, because you never really even addressed what was before that, what preceded that. So we have to do it together. We do it combined. I love partnering with our mental health professionals and our even mental health coaches, nutritionists. I love the collaboration, because this is where the patient truly shines and wins, and putting themselves back in that driver's seat.
Yeah. Before we move on from this, I want to talk about food just in a little bit more detail to give people some examples. So I'm sure, you know, people may have even been out on Google and they've Googled the, you know, anti-inflammatory diet, or what foods are considered anti-inflammatory. So, you know, things like tomatoes and like olive oil and, you know, like green leafy vegetables and nuts like almonds, walnuts. What else do I talk about a lot? Oh gosh, fresh fruit like strawberries and blueberries. Yes. Where they're antioxidant properties. Of course, like the fatty fishes, so like salmon and mackerel, tuna, sardines for those that like sardines. I'm not a fan, but sardines have a lot of beneficial health properties. Mushroom. So besides those, are there any others that I'm leaving out?
Oh, there's so many, which is why it's so fun and so beautiful. You know, there's so many, right? And I wouldn't even be able to exhaust it all, that list. But I love things like soursop. It's a huge. It has so many minerals in that beautiful fruit. Soursop is amazing. You have to look that up. Tart cherry juice. Make sure it's tart cherry juice and tart cherry juice alone, no added sugar. It's amazing for antioxidants and decreasing inflammation. You have moringa, you have green tea even, right? That's still a very, very helpful, potent one. Even sea moss, beautiful, beautiful sea moss, right? These are really amazing things. Some people don't like the taste of a lot of the things I'm saying right now. However, you can't go wrong with a smoothie. So get familiar and get excited about your smoothies, because this is where your body will shine when you don't really want to eat the beet, but you can put the beet in the juicer and get it down, right? Celery juice is so many. We would never exhaust that list, Dr. Jamie, but yes, you're so right. I hope that you're all writing it down. In Fab Squad, get into action. Go ahead and put that in the comment section, because if you hit this on the replay or someone else is out here listening later, you're going to be helping them. So let's get into action for sure. If you heard these things, Dr. Jamie just gave you like 30 things, and we're sharing some more here. Like, definitely go ahead and get your pen and paper out if you're not driving. And these are going to be so helpful. But yes, continue to follow her and follow us, so you can hear more about it. But these are some amazing, the list goes on. But one of the easiest things I try to tell people to do so they don't have to overthink it is just make sure your plate is colorful, okay? We want at least 3 colors on that plate every time you sit down to eat. At least 3 colors. Preferably push yourself to 4. But you want to make sure that plate is beautiful and rainbow and looks like a healthy bag of Skittles.
I love that.
We want to make
eat the rainbow for sure.
Eat the rainbow. So if you sit down, you made your plate real fast, and you look at it and you only see 2 colors, go grab something that's a different color. I don't care if it's an apple. Sometimes we get caught up, right? Like, an apple for dinner, yes, ma'am. You can chop up some apples and put it on the side of your plate and make it work and make it do what it do, as they say, right?
Yeah.
We want to make sure we start getting into habit to push ourselves towards that and get ourselves out of these boxes. Who says that breakfast has to be grits and bacon? It doesn't have to be. Right. It can be. It doesn't even have to be oatmeal, quite frankly. You can literally put. If you eat into chicken or you're into fish, it could be a baked piece of fish. It could be a baked piece of chicken, right? Along with, it could be a salad for that matter. Just make sure you don't overdo with the dressing. But we have to think outside the box. Make sure your plate is colorful, and make sure that your kitchen supports your goals, your health goals, your MVP goals, but your Fab Squad goals, right? Make sure your kitchen supports those goals. And the way to do that is step into your kitchen. I challenge you, because we all home, right? I think we all home. We all quarantined.
Hopefully.
So walk into your kitchen if you're on your phone. Open your pantry door right now. Open your refrigerator door right now. Step back. Take inventory. How much of that? What percentage of your kitchen supports those health goals? And if they don't, if you're less than 70%, we got some work to do, right? If you're at 85, 90%, you winning. You're doing a thing. We really want to start to look at it like that. And again, going back to what you said, Dr. Jamie, we have to be deliberate. It's about that intentionality. Sometimes I don't even think we realize what we brought into the house. But if we looked at the percentage of our pantry or our refrigerator, what percentage of that really supports our health goals, what we say we want, right? And put in that chat right now to let us know what percent. There's no judgment, so nobody judges.
No judgment. This is a safe
to support you and love you. This is all for transparency and love. Fab Squad, we're here to all be fabulous together. We're all a work in progress, right?
Yeah,
we're all a work in progress. So I just want us to put that out there, though, but it's all about being deliberate. Let's be deliberate with our health goals.
I love that. So what about people who feel like they're just going through this process by themselves? There are so many people out there that are struggling and dealing with pain. So what are your thoughts on, people finding a community or a tribe? I'm so big on community, right? So people kind of shy away from the term support group like it's a negative term, but just a group of people who are on a similar journey who can, support you through this process because they're going through it too.
Yeah, I mean, like you said, find your tribe. I think it's really critical. You can't do this alone. I don't really suggest anybody do anything in life alone. You'll get so much further and you'll win so much bigger when you do it together. And to Dr. Jamie's point, maybe that tribe is not 50 or 500 people. It may be 2 other people. It might be start off as 1 other person. The idea is that there's accountability there, right? Someone who truly wants to see you win, someone who will keep you accountable in spite of yourself at times, right? True accountability to help you get there. So there's actually a lot of support groups out there, believe it or not, be it online. There's obviously things in person as well. Some are free, some are paid. But I honestly, because for the sake of not even endorsing anyone in particular, but even your community, right, in general, I will gladly endorse your community. Your community is amazing. You know, those women are truly there because they want to be fabulous in all aspects of their life. You're such a great motivator. You're such a great encourager. I think a community like that is like boom, right there online. You know, you have a Facebook group, you have an offline community as well. I think wherever city that you're in, start Googling it. Actually look for exercise or fitness or wellness groups, right? And do that on social media platforms as well, because there's so many free platforms out there as well. Sometimes I know that people seek that out because they may in their own family, they may be the only one on that journey. That can be tough at times, right? You might be the only one in your household that's interested. And so sometimes that's why the accountability doesn't necessarily come as close to home. And those are the times I would encourage people to reach out. But sometimes they might be closer to home. It might be a cousin across the city or across the state even. But if they can call you, they can check up on you, they can push you, they can encourage you, they can keep you accountable. Even that is definitely a huge, huge win, because the idea is just someone who's in your corner who wants to see you win, and they almost won't let you fail in spite of yourself, right? That's what that's about. So that tribe is, and I've benefited on so many different platforms, you know, physically, financially, spiritually, because I find my tribe, right?
Yeah.
That's so important in any area of life that you're going to embark upon.
Yeah. All right. So here's something else that I definitely want us to touch on around living with chronic pain. And that is setting and managing expectations. So you mentioned it earlier that pain freedom does not mean zero pain, right? And I know we're encouraging people to keep these activity and pain logs or journals, whatever they want to call them. But how can people be realistic as they go along this pain journey? Because getting to 0 out of 10 is not realistic. I'm just going to say that.
Yeah.
So how do we help people to determine, I guess, what's reasonable, you know, for them? Because it's not 0. That's not realistic. And that's not setting their healthcare provider. Right. We want them to win, and we want them to even have a winning relationship with their provider, but their doctor is not going to get them to a 0 most of the time. So let's just spend some time talking about these expectations and how to be realistic and manage them.
Sure, definitely love it. So there are some situations, like you just put in, like actually most situations, once you get into that chronic phase, which we're trying to prevent people from getting there, but in the acute phase and even subacute at times, it may take you a while to get there, but some people will actually arrive to 0 pain. If we can get that healing started early. It's all about early intervention. In most situations, almost all situations, but I won't put that statement on there because almost can never say that in medicine. But in general, you know, sometimes when it's acute, and it's, you know, we can sometimes get you there, but it's not just us. I always say that too. I can't stress it enough that even when you come into your physician's office, they're not the MVP of that team. You are. We're really the point guard, okay? Passion, boom. You know, for those who don't know the reference, I'm a basketball player, so I typically use that reference. But in general, the whole idea is that you are that person. So I'm only as good as you allow me to be, or I'm only as good as you are with taking instruction or taking feedback or actually activating some of those suggestions. So when it comes to managing your expectations, those are definitely, I say, and I encourage you to go into your physician's office and ask that question. What's realistic, doc? What can I expect from this? You know, I try to get offered that without them asking, but sometimes it's not because your doc doesn't care. I just want to start empowering, like you said, our Fab Squad and just patients in general of what questions that they should be asking. And that's one of the questions. What is realistic for me to expect? What can I expect from this condition or that condition based on X, Y, Z, A, B, C. That'll start you at least getting an idea of like, oh, okay, because before I asked that question, I thought this. And now that you understand, you say, oh, okay, well, that's more realistic. I will be honest with you that, because we're not all created equal, I've had quite a few patients tell me, well, my doctors told me, never get better, I have to just live with it. I don't go that route either. I just don't feel like you should ever give people, you shouldn't give them a false sense of hope, but I don't think you should strip people from hope either. So we really have to find that middle ground. And so I never say just deal with it. That's not my approach. But I do want to then identify, again, going back to their history, going back to where they are, where they're starting, meet them where they are, let them teach them or help them and educate them on how to bite off a little bit at a time, and understanding that every little bite you take, when you accomplish it, it's a win. It's a win, and you should celebrate yourself. Sometimes we beat ourselves up, right? And we don't even, so our expectations, once again, are like so high that when we do actually some really amazing things, we minimize it, or we don't even celebrate it. We don't acknowledge it. Hence that, that messes with the expectation or even your ability to realize that you made improvement. And so I really think managing the expectations, to your point, it goes back to mindset as well, but it also is attached to education, if that makes sense. Again, the pain log, that's a critical piece as well. And I often notice, which I educate patients too, if you're listening to the sound of my voice, a lot of times if you're someone suffering from pain, and you're in therapy, or you're doing a lot of the things that Dr. Jamie's been preaching for so many years now, right? Or even some of the things that I've discussed today, and you've been doing them, I encourage you to look at it again, like bite by bite, and as well as maybe a few weeks at a time. When you look at it day to day, it's blurry. We don't typically see the results or even feel like we've made big gains day to day. But if you actually allow yourself to, again, keep the record, keep the journal, log, just keep pouring into yourself from that perspective, keep investing in yourself. And you're going to open that journal and look back a week, or look back a month, or look back 6 months from the date that you're like, oh my gosh, look how far I've come. Yeah. That's where that intentionality comes from. That's where that deliberate piece comes from. And that's what actually helps you manage your expectations too, because you'll get to realize as you activate that in real time that you are deserving. You're going to get there in terms of, if you, long as you stay in momentum and keep investing, never give up on yourself, and never allow someone to tell you to give up on hope. I don't care how many degrees is behind that person's name. I don't, even though I can say you'll never get to zero pain, I'm also not saying that you should give up hope. They're not all one and the same. The point is, like Dr. Jamie just said, it's managing what is considered realistic, because you can still live a full quality of life, just understanding that you're in the driver's seat, and that your management or your maintenance may look a little different than the next person. But we're not comparing ourselves to anybody else's journey. Your journey is your journey, and that's really, really important for you to embrace it, love it, and keep moving forward with that, and stay connected to your tribe, stay connected to your physician once you find one that jives with you, and just continue to invest in yourself in that way.
I have something else, Dr. Z. Dr. Zarinah, look, I call you Dr. Z too.
We can do that. We can do that. I love
Dr. Zarinah, so exercise is, very important to a healthy lifestyle in general. But exercise has many other benefits besides just, how we look on the outside, right? And I talk about this all the time. But for my Fab Squad members who are, living or, navigating a pain, issue or a challenge, one of the things that they often tell me is, I want to exercise, but I am unable to because of my pain. So how do we, what can we help them to be able to do? What words, of encouragement or tips can we give that woman or that man who really understands the need to exercise and has the desire, but that pain is the barrier?
Yes. I think, again, it goes back to expectations, managing your expectations of what that looks like. Because in their mind, I can't exercise. For some, if you say, what does that look like? What do you think you can't do? Again, give it breath, give it life in terms of what you're actually saying, so that we can articulate it and then break it down to create a solution, because there's always a solution, in my opinion. So once they are talking in that way, first let's break down what are they assuming that looks like, first of all, right? Because they may say, oh, I can't run a mile, or I can't, so then you start to hear the language or what they're really saying. Someone else might say, oh, I can't walk a block. So it's going to look different from person to person, but I think first you have to allow them and give them and almost force them to really put words to it. What do they mean by that? And sometimes what their expectations are just like way over there. And you're like, well, that's not what I was talking about. I wasn't saying you need to run a mile. What I'm actually saying that what I want you to do is stand up and sit down 10 times, and do that every hour. That might be where they start. And that's a win. If you got through the day and you said, I sat up and sat down, stood up and sat down 10 times, and I did that 5 times, you write that in that journal, that's a win. Because you know why? You didn't do that last week.
Exactly.
So, that is a win. And then before you know it, in 2 weeks or 3 weeks, it's easy. So now we're going to step you up. We're going to do something else, right? So that is a huge piece of that. I feel like you just have to identify, first of all, what do they mean by that, what they cannot do. I have a lot of people, the big thing is I can't do squats, as if that's the only exercise in the world. My knee pain patients or clients, that's their biggest thing. I can't do squats, Dr. Z. I can't do squats. Well, okay, but we can do other things, right? We can do things lying down. We can do low impact type of things. We can do, again, you might get in the water, if that's available. And sometimes we have aquatic therapy. Water exercises are really, really helpful for people with chronic back pain, knee pain, and hip pain in particular, right? Because it creates that buoyancy and you can do more activity in the water without the grinding sensation that creates with in some of those situations. But you also have vitamins and supplements. I don't want people to minimize that. When I talk about that, those vitamins and supplements may come in the form of your food. We have to go back to that. So sometimes it's not just the physical, right? But you want to make sure that you're doing the combination of things so that you can really optimize your goals. At the end of the day, it's not one thing that exists that is going to help you. It's not like that. Which hence Dr. Jamie talks about lifestyle so much. It's the combination. And we're complex human beings. We're not made up of one thing. So why would we even suggest that would be one thing that's going to get us to our goal? No, it's a combination between our physical, our mental, our spiritual, that we have to address all those things. And I want you to do those things every day. So you're going to tap off of one aspect of all of those categories, and then that's where you are. So I exercised today, and then I sat for 10 minutes quiet and didn't people word. You'd be surprised what that does for the body.
Yeah.
Not just the mental, I feel that stress, but also that's going to then release the stress in your body as well. So it's just little things like that. And I encourage people. I cannot stress that enough.
Yeah. And I love that you made this digestible for anyone at any point. And I do feel like people often compare what they do or don't do to others. So yeah, you may not be able to run a mile or, walk completely around the whole block in your neighborhood, but maybe you were able to walk to the mailbox and get the mail yourself today and not have to send your spouse, significant other, child, grandchild to get the mail. Like, y'all, there are little things that we can do to still be physically active. So even if that's just walking to the kitchen and not necessarily getting a snack, but walking in there and then walking back to the front door, like you can even just count those wins, and
they are wins. They are.
They just build on it. I love that.
I look forward to celebrate when they come in there and tell me the things, because before that they didn't even celebrate those things, right? No. They were, and they even sometimes they'll come in and say, I didn't tell my husband this because he would have looked at me like. But then they come to me and they know I'm going to celebrate them. We're going to cheer loud. Everybody else on the outside going to hear it. It's really important. That just lifts people up and allows them to remember I'm valuable. I deserve this. I can do this. Keeps them encouraged and keeps them, like you said, motivated to continue to do that. Because sometimes not only do they compare themselves to what they see other people doing, they compare themselves to what they used to be able to do. Oh. That's a really common one. It's like, well, I used to be able to do this and I can't do that anymore.
Look, and you used to be 25 years old and you're not 25 anymore.
Okay. Nothing stays the same, right? Nothing. Energy on this transporter is never the same. Okay.
Yeah.
So that's a huge piece of that. It's like, okay, well, we're going to create a new normal. right? So we don't have to get stuck. And that's a mental thing too. Again, I can't get away from that because you're talking about what I used to be able to. That might be physical and mental for them when they're really saying it if you break it down. They may really be talking about something else, what they used to be able to do. We're going to create a new normal. We're going to let go and push forward so that we can truly step into whatever that new normal is, so that we can be in that fullness all together and continue to just propel yourself.
So for those that understand the importance of their physical activity and they've been given, their prescription of exercises to do at home, but they find that it's just laying on the bedside table, and for whatever reason, they know they should do it, they understand the benefit, but they're not motivated. How do we motivate women, especially, to pick up the exercise list and do the exercises?
I think it actually is different from person to person. And I always say, if you can identify what their vulnerability is, their vulnerable space, what is their drive, then you can get them to do it. I often try to find out, well, what is it that keeps them from doing it in the first place? Or what is it that drives them? So when you remind them of that sensitivity, I typically can find them, they can more easily do it because they attach doing it with what they truly value.
Okay.
Oftentimes we as women, it's not us. We're not enough motivation, sadly. We'll get there. But that won't be the motivation. Do this for yourself. That's not the motivation. It's just what it is. We as women are typically so selfless to a fault, where we're givers, but not to ourselves. And so we don't even look at this as something that's priority. And in particular for me, it's going to take away from time from my children, or take away from time from my job, or take away from time from my husband, right? So we have to identify for that person, what is that sensitivity? What is that vulnerability space? And I often find that if I can tap into that, then they can then connect the doing, the activity, the activation of that with that makes it the more valuable piece. Okay, oh no, that's worth it. Then okay, well that's worth it because this is something that I truly value. If I say it, I know it, I bleed it, so to speak, then we can get them to do more. And they're still gonna have the slide backs, right? Because their natural inclination or their habit has been otherwise. So that's where the tribe comes into play, Get connected with your Fab Squad, okay? You have to be connected. That's where that comes into play, so that if we backslide, we have somebody that can help us, pull us back up, stay the course, stay connected, and remind us of that. But I don't think, in my experience, you can share, I would love to, if you found it differently, but I noticed that year after year after year after year, me trying to plead to them that you're worth it, it's you, that's not, it doesn't do it, not for women typically.
Yeah.
Because we're just so used to not putting ourselves first in that way. It's just, it's taught to us after generation, like it's just not second nature. So we have to identify what is that thing then currently that drives you, that attaches to your value and that sensitivity. It typically helps at least get it started in my experience.
Okay. I like that. I like that a lot. So morning stiffness.
Woo.
I hear about this a lot. So I have not gotten to the point yet where morning stiffness has invaded my mornings, but if I am blessed to live long enough, I expect it to come. So for those out there who are dealing with morning stiffness, is there something that I guess, physiologically in terms of their body that's causing it? First of all, people just really want to understand what's causing it. And then what can be done, if anything can be done about it. Every morning they have this stiffness.
Yeah. And it's probably worse at times, like sometimes when it's raining or it looks like it's going to rain, or the winters. Typically that's when it's worse for a lot of people. And then throughout the year they'll have it, like you said. Is it preventable? In general, we believe that it is, because what it is arthritis. But then there's also studies or a population of the physicians or specialists believe that we're all going to get it because we're all going to get arthritis. But the reality is, some of us have arthritis at 35, 40, 45, 50, 55, and not every arthritis is symptomatic. So I don't necessarily know that that's the case. And I do have patients who are in their 80s. They don't have morning stiffness. Why? It goes back to something we discussed a little earlier. It has to do with what you just said. Physiologically, the inside out and the outside in. I talked about that. That's kind of what I do, right? Helping people from pain to pain, from inside out and the outside in. So it's the combination, quite frankly, of our lifestyle of doing the things from the inside out and the outside in that helps that. What does that look like? Making sure that your diet and your lifestyle is anti-inflammatory, because a lot of that is going to help decrease and kind of keep things lubricated and things like that, antioxidants and decreasing inflammation in the body so that you don't have that inflammation in the joints. So that might come in the form of your food with your supplements in your smoothie, right? Where you're putting those things into your smoothie, that a lot of the things that we discussed earlier today. And then also from the outward part of that, I encourage people, one of the first things you should do is stretching, be it your yoga poses. That should really be one of the very, very, very first things that you do when you wake up in the morning. And in some cases, if your bed is firm enough, or even not firm enough, quite frankly, you can do a lot of those poses in your bed before you actually get out, so that you can feel a little bit more limber when you step out onto the ground. So that might look like literally what I encourage people, without the sake of standing up right now to try it and demonstrate it, is you want to literally stretch every single joint that you have in your body before you get up out of the bed. So that will require you to do, like, you ever seen those infants when they wake up, they do that. They go,
they do,
right? They do that. They get that all activated before you pick them up. Typically, and they're going to get it in too. You picking them up, they're going to get their
stretching. They're going to get their stretch out.
They're going to get that little stretch out, right? We want to do the same thing. Go back to the basics. And it really does help a lot of people. If you started to make it a habit, you'll notice that you'll have less and less morning stiffness. But again, what did I discuss? I talked about the physicality of stretching and getting your joints mobilized, but also one of the first things you're doing also is getting your body alkalinized and decreasing inflammation from what you put in your body first thing in the morning as well, right? Or just throughout the day. So you'll start to notice that combination of that lifestyle is going to start to reduce that either the frequency or the intensity of morning stiffness.
Oh, I love that. Okay, so stretches, you don't even have to get out the bed, ladies. You can stretch right in the bed. Get those good stretches in. Oh, here's something else, Dr. Zarinah. So a lot of people are working from home. So either 100%, at home because their office or workplace has allowed them to work from home, or working more days home and, just going in for a couple of days, right? But the thing about at home is that we haven't had the consultants or the team to come in and strategically place the office equipment, so that our bodies ergonomically can be positioned in a way that decreases, injury, strain, and pain, right? We're working at the kitchen table, at the dining room table, in the family room. Some people are on the couch or pulling up, the coffee table or a TV tray to use their laptop or to get on Zoom or however they're working. So what can people do to, I guess, outfit their homes so that they can still take care of their bodies as they're working remotely?
Right. And it's funny that you said that, because I was actually talking to my sister. She's a principal and she's a go person. And she actually is sitting more now, as you can imagine, than she was when she was, pre-pandemic. Yes. And so that is a real concern. So people are like, oh, I used to be, they didn't think they were as active, but compared to now, like, oh, wow, well, I guess I was moving a lot. And now they're doing a lot more. It's a lot more sedentary jobs.
Yes.
This just got built into the situation. So one of the things that I encourage people to do, because actually a lot of the people who already have sedentary jobs, this is going to help you as well. And I typically don't like Dr. Google, but I will encourage you for the sake of, because it's really pretty easy to find, is that if you put in ergonomic desk or ergonomic at home or ergonomic home office, you actually will find the degrees and such, because it's a little bit based on height as well sometimes, or where you're, the setting. But if you put in that ergonomic setup, you'll get a lot of information and pretty consistent information. That's why I could say you can actually go to Google this time because it's pretty consistent information that's going to allow you to understand what level your laptop should be, how you want to make sure that the small of your back is supported, right? Because we don't want that strain in the small of our back. We also want to make sure that we're actually paying attention. We don't realize that we don't realize we're doing this all day. So many people walk around like this and they have no clue, just no clue. Like seriously, no clue.
Relax those shoulders.
Relax those shoulders, okay? And not just relax. So we want to literally depress them. And when I say depress, we're going to pull them down to the ground and then back, okay? We want to pull them back. Or we want to make sure we're doing that really probably every 20 minutes, in particular if you're not getting up. So we want to make sure our shoulder is back, our chest is out. Yes, it looks funny, but that's not the point, right? We're really trying to reduce that, open up that cage. And then some people, they're hunched over, right, like this. So this is a huge, important activity, if you will, to make sure you depress your shoulders and bring your shoulders back and bring that chest out, and then taking deep breaths. The other thing I like to tell people is making sure that you actually are doing your stretches for your neck. And you want to do it on both sides. The same way I was talking about the stretches in the bed before you get out and you stretch every joint, very similarly, you want to be doing that with your neck, okay? And every rotation and every angle that it can go, up and down, okay? Side to side. We want to make sure we're doing that, even up to the side that way, and up to in the angles. We want to make sure that we're giving our bodies the motion that it was designed to do, and we really want to be incorporating that throughout the day. One of the hardest things to do is something you talked about already, Dr. Jamie, was just doing it. Well, some of the tips I give my clients and patients is we all have these things called cell phones. And most of these cell phones have at least about 30 alarms that you could put on it. Yes. Well, what you do is you set that alarm for I would typically say every 30 minutes, because it doesn't necessarily, everything doesn't require you to stand up. But every 30 minutes, you want to make sure you set that alarm to remind you, oh, ding, 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 it says exercise, or it says stretch, or it says drink of water, whatever the case may be. You use these things because we're on them anyway. They're right there in front of us. They're not really going anywhere. We know y'all have them by your side. So look, go ahead.
I got mine right here, right now. It never leaves my hand.
Never. Okay, so let's go ahead and optimize it and let it work for us, right? To make sure that we incorporate these alarms to allow us to remind us, because it's not second nature yet. So until it becomes second nature, we want to make sure we incorporate that. That way it activates you to actually do so. And the other thing I encourage people to do is stand up every 45 minutes to an hour and literally stretch. And you can do this for anywhere between 60 to 90 seconds or 60 to 120 seconds, and then sit back down. It doesn't have to take up a lot of time, but you need to do it. You cannot sit in that spot for 6 hours, 8 hours, heck, not even for 3 hours. That's too long to not move and get up and change directions or change positions. So it's really, really critical that you identify what's ergonomic for your setup. Like Dr. Jamie said, it could be the dining room table. It might be I actually don't encourage the couch. Please, ladies and gentlemen, if you're at home in quarantine, find a hard surface, put your laptop there. Please don't sit on the sofa for your office. I don't care if you pull up the kitchen chair instead, but do not sit on the couch. The reason I'm saying is because there's nothing ergonomic about it, and you cannot makeshift that. There's no way to remix it. The couches, sofas are not going to be ergonomic effective for you. So please identify some other sitting arrangement besides the sofa. But other than that, get up every 30 minutes. Make sure you're stretching every joint, including the shoulders, right? Some of us have big shoulder issues. We have elbow issues, maybe even wrist. We start getting carpal tunnel because we're on these computers. You want to go through every motion of every joint and angle that your body is supposed to go through, even if you don't go that far. Even as it doesn't go that far, you still want to take your body through those motions.
I love that. Get off the couch, y'all. Get off the couch. All right. I think we have time for maybe one more. We talked about like maintaining our balance as we age, right? Because, that helps to protect us from breaks and falls. And it also helps us to maintain our mobility. So what are some basic things that people can do just to, work on their balance?
That's a good one. So one of my favorite things is actually pretty simple. It doesn't require a lot of equipment, is your bare feet, okay, on a hard surface. And starting off, you would try to balance yourself. Bring a chair nearby, because if you already have balance issues, I need you to make sure you're doing this with holding one hand on top of like the back side of a chair. But basically what you're going to do is you're going to take one foot off the ground, and you're going to try to hold it as long as you can. while holding onto the chair, people, though, if you already have balance issues, or you're not sure if you have balance issues, because maybe you don't even know you have balance issues. Start with a chair. Start with a chair first. We don't want y'all trying it and fall and do the very thing that Dr. Jamie just
right.
we're trying to prevent. So use this with a chair nearby to make sure you kind of know what your baseline is, right? So you want to try to hold that as long as you can. And if you, or you just start off with 15 seconds even, right? And then you're going to switch and do the opposite leg. Eventually, when you can hold that position without maybe holding on a chair, and you can also do that, again, barefoot, no shoes. Don't do this with shoes because that actually kind of defeats the purpose. But you're just going to do this barefoot. And so you switch legs. Once you can master that and you can maybe hold 60 seconds on each leg, then you graduate to putting one pillow on the ground and you stand on that pillow and do the very same thing. Repeat that and see how long you can hold your balance and do the opposite leg. Then once you master that, you can add a second pillow. So now you're on 2 pillows. What that does is increases the complexity or the difficulty of that particular balance exercise. And this is really helpful also with increasing what we call eccentric exercise and actually even concentric muscle contraction to help balance, increase strength. But also what it does is improves proprioception, which is huge for balance. Proprioception is that, I guess you can say, signaling from the brain to those joints that tells the body or the ligaments and the connective tissue to basically stabilize, because you're trying to do something that the body thinks you should fall for. But you want to improve that intensity and stability by exercising, by doing these type of proprioception and balance exercises. It's really any age can do it. Again, I just stress that do it with nearby, not a wall, where I really want something fairly sturdy that if you toppled over, you wouldn't really topple over because you're standing near something that is sturdy, that could actually hold some weight. But that is a really, really good exercise to start even young children on as they're trying to get their balance together, improve that. If you're an athlete, is also really good. Believe it or not, some of them, their balance is actually not that great, and that could increase propensities for injury, like you just said. So this is for athletes and the weekend warrior and the 70-year-old. This is really, really important for all of us, quite frankly. And strength and flexibility have to go hand in hand. You can be really flexible, but not that strong. You're going to increase your chances for injury. You can be really strong and not have enough flexibility. You're going to increase your chance for injury. Just facts.
Yeah, I love it. Oh my gosh, Dr. Zarinah, you gave us so many nuggets. And the thing that I, enjoyed about this topic was that it is something for everyone. There's this misconception that only older people struggle with, mobility issues and pain and balance issues. No, so these are tips that we all can implement no matter, what stage of life we are in. So we talked about the lifestyle principles, y'all, okay? And, setting those realistic expectations, partnering with your healthcare provider, keeping that detailed log or, and journal, having that data to go in and support, the symptoms that you are experiencing, paint the full picture for your healthcare team so that they can make whatever tweaks are necessary, right? So you have to give them the data. They want to help, but you have to come armed with the information and share it. Yeah.
Please.
I love it. And, finding a tribe, it could be just one person, it doesn't have to be this massive group of 500 or 5,000. Even if you just have one person that you can, talk to and share your wins with, oops, girl, today I fell off, and they can help you pick it back up and get back on.
That's right.
That's so important. And, just realizing that no matter where you are, there's something that we all can do every day to get better. It's just taking baby steps and, attacking it little by little. So many times we just try to go, gangbusters and just do so many things all at once. And we have to be realistic with our goals that we are setting and be realistic with our expectations, even the expectations that we have of ourselves. All right. So that's the recap. I want to encourage everybody that listens to this live, hit the share button, because there are people in your family, there are people that are working with you, on your job, there are people in your church, in the neighborhood that may not have seen us live, don't be stingy and sit on the information, y'all. Help me and Dr. Zarinah spread this message about pain freedom all around the world. So hit the share button and share this information, all right? Because we're not stingy in the Fab Squad. We're givers, we're sharers, we learn and grow together, all right? So that's your only homework from me. Hit the share button. But Dr. Zarinah challenged y'all, and I'm gonna co-sign it. Go in that kitchen, okay? Open up that pantry, open that refrigerator. And we talked about those foods that are things that will help to decrease the inflammation, in your bodies. Take an inventory. Does your kitchen support this lifestyle of pain freedom that we are all after? And it doesn't have to be a zero. That's not the take home point. Pain freedom is not zero, right?
Right.
That's my recap. Dr. Zarinah, any closing words or remarks?
No, you did wonderful. I think that, and I can't say it any better. Dr. Jamie has spoken. So no, I don't have any closing remarks. Just, go forth and be amazing. Because, like I said, we all deserve to remember and understand that we are the most valuable person. We cannot put that title on anyone else because we cannot ever realize our fullest potential in any category of our life. Yeah. And definitely it starts with our health, and because we only get one of those, but everything else, extends from that. Everything else extends from that when we truly understand that we are the most valuable, and we become even greater for those who we say we want to serve. Be that your children, your husband, your job, your business, your whatever you're saying, but it has to start with you, and that's how we invest in ourselves, and are we truly identifying ourselves as the most valuable person, MVPs of our life and health.
I love that. All right, so y'all are the MVPs, Fab Squad. You heard it here, all right? I love y'all so much. Thanks for tuning in. Hit that share button and go in that kitchen. Challenge. Bye, y'all.